Part A. Extract 1. Questions 1 to 12. You hear an ENT talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. It's nice to see you again. How are you and your child doing today?
Good morning, Dr. Evan. Well, honestly, I'm a bit worried. Since our last visit, I've been noticing that my daughter's symptoms haven't improved much. In fact, some new issues have cropped up. I thought the medication would help, but I'm not sure it's working.
I'm sorry to hear that, Mihiraa. Can you describe in detail what symptoms your daughter is experiencing now compared to our previous visit?
Sure. So, last time, we were mainly concerned about her constant earaches and the congestion. The earaches really bothered her, especially at night. You prescribed an antibiotic and some nasal spray, which seemed to help for a few days, but then the earaches came back. This time, it's worse because she's also complaining of a ringing sound in her ears, which wasn't there before.
I see. That's concerning. How long has this been going on, and does it occur constantly or only at certain times?
It started about a week after we last saw you. It's not constant. She says it's more noticeable when she's lying down or in a quiet room. I've also noticed she's been more irritable, especially when trying to concentrate on her schoolwork, and she's been having more trouble sleeping.
That sounds like tinnitus, which can be quite distressing, especially for a child. Has there been anything else? Any changes in her hearing, balance, or any other new symptoms?
Yes, actually. She mentioned that sometimes her ears feel full, like there's pressure in them, and she's been saying that she's having a harder time hearing what her teacher says in class. There was one incident where she felt a bit dizzy after standing up quickly, but that's only happened once.
Thank you for providing those details, Mihiraa. It sounds like the symptoms have indeed evolved. Have you noticed anything that seems to make her symptoms better or worse? For example, any changes in her diet, environment, or activities?
We've tried to keep her away from any loud noises, and I've made sure she's eating well and staying hydrated. But I've noticed that when she's more active, like after playing outside, she complains more about her ear pain. We've also reduced her screen time, thinking that might help with her sleep, but it hasn't made a difference.
That's good information, Mihiraa. Let's go ahead and do a quick physical examination to check her vital signs and have a closer look at her ears. Her temperature is 37.2 degrees Celsius, which is normal. Her pulse is a bit elevated at 105 beats per minute, likely due to her discomfort. Her blood pressure is 110/70 mmHg, which is within the normal range for her age. Let me take a look inside her ears now. There's definitely some inflammation in both ears, and I can see fluid behind the eardrums, which could be causing the feeling of fullness and hearing issues. I also noticed some congestion in her nasal passages, which might be contributing to the problem.
What do you think is causing all this, Doctor? Is it something serious?
It appears that she may have a persistent middle ear infection, which hasn't completely resolved despite the initial treatment. This could explain the earaches, pressure, and hearing difficulties. While it's not uncommon for these symptoms to linger, I understand how distressing this can be.
So, what should we do next? The last treatment didn't seem to help much.
We may need to take a different approach this time. I'll prescribe Cefixime, a stronger antibiotic, to tackle the infection more effectively. In addition to that, I'll give you pseudoephedrine, a decongestant to help reduce nasal congestion and improve fluid drainage from the ears. We'll also continue with the nasal spray, oxymetazoline. I'd like to see her again in 2 weeks to reassess her condition.
Sure. Thank you, doctor.
Extract 2. Questions 13 to 24. You hear a cardiologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you in today?
Good morning, doctor. I've been experiencing some chest pain lately. It feels like a tightness. And I'm really concerned. It's been happening more frequently, and I thought it was time to get it checked out.
I see. Could you describe the pain you're feeling? Where exactly do you feel it, and how would you rate it on a scale of 1 to 10?
The pain is mostly in the center of the chest, but sometimes it radiates to my left arm and even my jaw. On a bad day, I'd rate it around a 7 or 8. I've also noticed some shortness of breath, especially when I climb stairs or walk quickly. It's really unsettling.
That does sound concerning. Have you tried anything to relieve the pain or discomfort?
Yes, I've tried taking some over-the-counter antacids because I thought it might be heartburn, but they didn't help much. I've also tried resting when the pain comes on, which sometimes makes it a bit better, but it doesn't go away completely.
How long has this been going on, and can you remember when you first noticed these symptoms?
It started about 2 months ago. At first, it was just occasional, once or twice a week, and it wasn't that intense. But over the past few weeks, it's been happening more often, almost every day. The first time I felt it, I was just sitting at home, relaxing, and suddenly felt this high pressure in my chest. I didn't think much of it at the time, but now I'm worried because it's not going away.
Have you experienced anything like this before? Do you have any other medical conditions or take any regular medications?
I've never had chest pain like this before. But I do have high blood pressure, which I've been managing for about 5 years. I'm on amlodipine for that daily. I was also diagnosed with high cholesterol last year, and I'm taking atorvastatin, 20 milligrams. I've had a couple of episodes of dizziness recently, but I didn't think much of them until this chest pain started.
Thank you for sharing that, Mihiraa. Let's do a quick physical examination. I'll check your blood pressure and heart rate, and listen to your heart and lungs. Your blood pressure is 150/95, which is a bit high. Your heart rate is 88 beats per minute, slightly elevated but within the normal range. I can hear a slight murmur, which we'll need to investigate further. There's also some irregularity in your heartbeat, which I'd like to look into. Based on what you've told me in the examination, I'm concerned about the possibility of angina. To get a clearer picture, I'd like to order some tests. We'll do an electrocardiogram, or ECG, to check your heart's electrical activity, and a stress test to see how your heart performs under physical exertion. I might also recommend an echocardiogram to get a detailed image of your heart.
That sounds a bit serious, doctor. Should I be worried?
I understand it can be alarming, but it's important to find out what's causing your symptoms so we can treat it effectively. For now, I'd like you to avoid any strenuous activity and take it easy. If you experience chest pain again, you can take a nitroglycerin tablet which I'll prescribe. However, if the pain doesn't go away after taking the tablet, or if it gets worse, you should seek emergency medical help immediately.
What treatment options might I need to consider if the tests show something serious?
Depending on the results, there are several options we could consider. If confirmed, we might manage it with medication like beta blockers, ACE inhibitors, or calcium channel blockers. In some cases, we might need to look at procedures like angioplasty. Another option could be coronary artery bypass surgery if the blockage is severe.
I see. I really appreciate you explaining everything, doctor.
You're welcome, Mihiraa.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a charge nurse called Mihiraa talking to nurses. Now read the question.
Nurses, I'm excited to introduce our new fleet of wheelchairs. These advanced models are designed to enhance patient comfort and mobility. They feature adjustable features, ergonomic seating, and improved maneuverability.
That sounds great. How do these new wheelchairs compare to the ones we currently have?
The new models offer superior comfort and support, reducing the risk of pressure sores and discomfort during extended use. They also have a more intuitive design, making them easier for patients to operate independently.
That's fantastic. Will this improve patient satisfaction?
Absolutely. By providing patients with more comfortable and functional wheelchairs, we can enhance their overall experience and improve their quality of life.
Are there any specific features that we should be aware of?
Some of the new wheelchairs have built-in features like cup holders, storage compartments, and even lighting for nighttime use. It's important to familiarize ourselves with these features to ensure patients are using them to their full potential.
Now look at question 26. You hear a doctor called Mihiraa talking to a charge nurse. Now read the question.
Nurse Paul, I'd like to discuss the possibility of conducting a lecture session for the nursing staff on the latest advancements in diabetes management.
That's a great idea, Dr. Mihiraa. Our staff could benefit from updated information on the latest treatment options and best practices.
Exactly. I can cover topics such as new medications, insulin pump therapy, and the importance of patient education. I believe this will enhance our team's knowledge and skills in managing diabetes patients.
That would be very helpful. When do you think would be a good time to schedule the lecture?
How about next week on Wednesday afternoon? We can arrange a convenient time slot that doesn't interfere with the staff's workload.
That sounds perfect. I'll coordinate with the nursing team and ensure that everyone is available, Dr. Mihiraa.
Great. We can also discuss any specific questions or concerns the staff may have beforehand. I want to ensure that the lecture is informative and relevant to their daily practice.
Now look at question 27. You hear a cardiologist called Mihiraa talking to a patient. Now read the question.
Mr. Paul, the pacemaker insertion was a success. The device is now functioning properly and regulating your heart rhythm.
That's great news, Dr. Mihiraa. I'm feeling much better already.
It's important to follow some precautions to ensure the optimal functioning of your pacemaker. Avoid strong magnetic fields as they can interfere with the device. Also, inform your doctor about any new symptoms or changes in your condition.
Will I need to get regular checkups?
Yes, you'll need to schedule regular follow-up appointments with your cardiologist. We'll monitor the pacemaker's function and make any necessary adjustments.
I'm concerned about the battery life of the pacemaker. How long will it last?
Pacemaker batteries typically last around 5 to 10 years. When the battery starts to wear out, we'll need to replace it. The procedure is usually less invasive than the initial implantation.
I'm also worried about the risks associated with the pacemaker.
While the risks are minimal, it's important to be aware of potential complications, such as infection, bleeding, or device malfunction. However, with proper care and regular follow-ups, these risks are significantly reduced.
Now look at question 28. You hear a nurse called Mihiraa talking to a patient's family. Now read the question.
Mr. and Mrs. Paul, it's important to understand Mr. George's medication regimen. He's taking multiple medications for his heart condition and diabetes.
We're trying our best to keep track of all his medications, Mihiraa, but it's sometimes confusing.
I understand. It can be overwhelming. Let's review his medication list together and ensure you understand the purpose of each medication and the correct dosage.
We're also concerned about potential side effects. How can we recognize if he's experiencing any adverse reactions?
It's important to be aware of common side effects, such as dizziness, nausea, or changes in appetite. If you notice any unusual symptoms, please don't hesitate to contact us.
Can you recommend a medication organizer to help us keep track of his medications, Mihiraa?
Absolutely. A pill organizer can be a helpful tool. We can provide you with some options.
We're also worried about the cost of his medications. Are there any programs that can help with the expenses?
I can check with our social worker to see if there are any financial assistance programs available. We want to ensure that Mr. George has access to the necessary medications without undue financial burden.
Now look at question 29. You hear a dermatologist called Mihiraa taking a lecture. Now read the question.
Blackheads are a common skin condition caused by clogged pores. They occur when oil and dead skin cells build up and become trapped in the pores, creating a dark plug.
Mihiraa, is there anything I can do to prevent blackheads?
Yes, there are several steps you can take. First, gentle cleansing is essential to remove excess oil and dirt. Avoid harsh scrubs that can irritate the skin. Second, consider using a non-comedogenic moisturizer to keep your skin hydrated without clogging pores. Third, limit your use of makeup, especially oil-based products.
I've tried using over-the-counter acne products, but they haven't helped much.
Some over-the-counter products can be effective, but it's important to choose the right ones. Look for products containing salicylic acid or benzoyl peroxide. However, if your blackheads are severe or persistent, you may need to consult a dermatologist for further treatment.
Are there any procedures to remove blackheads, Mihiraa?
Yes, there are professional treatments such as cum-done extraction and chemical peels. These procedures can help clear blackheads and improve the overall appearance of your skin.
Now look at question 30. You hear a GP called Mihiraa talking to a surgeon. Now read the question.
Dr. Paul, I'm referring Mr. George to you for a consultation regarding his persistent abdominal pain. He has a history of heart disease and diabetes.
Thank you for the referral, Dr. Mihiraa. I'll review his medical records and schedule an appointment. What are his main symptoms?
He's been experiencing intermittent abdominal pain, along with bloating and changes in bowel habits. He's also noticed some weight loss.
That's concerning. Could you provide me with any recent lab results or imaging studies?
Yes, I've attached his most recent blood tests and abdominal X-ray. There are no obvious abnormalities, but I'm concerned about the possibility of an underlying gastrointestinal issue.
I'll carefully review his medical history and the provided information. Once I have a better understanding of his condition, I'll determine the appropriate course of action, Dr. Mihiraa.
Thank you for your time. I appreciate your expertise in this area. Please let me know if you need any additional information.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a plastic surgeon, Dr. Mihiraa, and an interviewer.
Good morning, Dr. Mihiraa. It's a pleasure to have you here today. To start, could you explain to our audience what a plastic surgeon actually does? There's often confusion about the scope of this field.
Good morning, and thank you for having me. The field of plastic surgery is quite broad, and it encompasses much more than what many people typically think of, which is cosmetic surgery. As a plastic surgeon, I deal with both reconstructive and aesthetic procedures. Reconstructive surgery involves repairing or reconstructing parts of the body that have been affected by congenital defects, trauma, infections, tumors, or diseases. This can range from cleft palate surgery in children to complex hand surgeries after severe injuries. On the other hand, aesthetic or cosmetic surgery focuses on enhancing or modifying the appearance of a patient according to their desires, which includes procedures like facelifts, rhinoplasties, and breast augmentations. The unique aspect of plastic surgery is that it's not confined to one part of the body or one kind of tissue. We work with skin, bones, muscles, fat, and nerves across the entire body, making it an incredibly diverse and challenging field.
That sounds like a very demanding career path. Speaking of which, could you tell us about the early stages of your career? What were some of the challenges you faced as you were just starting out, Dr. Mihiraa?
Certainly. The early stages of my career were a mix of excitement and daunting challenges. Like many medical professionals, I started with a broad medical education, But once I decided to specialize in plastic surgery, the learning curve became quite steep. In the beginning, one of the biggest challenges was mastering the sheer variety of procedures. Unlike other specialties that may focus on a specific system of the body, plastic surgery requires proficiency across many different areas. I remember the long hours in the operating room, where I not only had to perfect my technical skills, but also develop an artistic eye. Another significant challenge was building trust with patients. Plastic surgery often involves elective procedures, and patients are putting a lot of faith in your ability to deliver results that align with their expectations, which adds an additional layer of pressure, especially when you're just starting out. However, these experiences were invaluable in shaping my approach to patient care and surgical precision.
It's clear that the journey wasn't easy. Along the way, you must have encountered numerous challenges in treatment, particularly in complex cases. Dr. Mihiraa, how did you overcome these obstacles, and what strategies did you employ to ensure successful outcomes?
Indeed, treating complex cases in plastic surgery can be quite challenging. These cases often require a combination of surgical expertise, creativity, and sometimes even a bit of improvisation. One of the strategies that I found particularly effective was interdisciplinary collaboration. For instance, in reconstructive surgeries for cancer patients, working closely with oncologists, radiologists, and other specialists allowed me to develop more comprehensive treatment plans. Another important approach was staying updated with the latest technological advancements and techniques in the field. For example, the advent of 3D printing has revolutionized reconstructive surgery, allowing us to create custom implants and prosthetics tailored to each patient's unique anatomy. Furthermore, I always emphasize the importance of a thorough preoperative assessment. Understanding a patient's medical history, psychological state, and expectations helps in anticipating potential complications and managing them effectively. In some of the most difficult cases, it was this combination of collaboration, continuous learning, and meticulous planning that enabled me to overcome obstacles and deliver successful outcomes for my patients.
It's fascinating to hear how you've managed to navigate such a complex field. Plastic surgery has certainly gained a lot more recognition and acceptance in recent years. How do you think your profession has evolved to become more popular than it was in the past, Dr. Mihiraa?
The evolution of plastic surgery into a more popular and accepted field can be attributed to several factors. First and foremost is the improvement in safety and effectiveness of the procedures. With advancements in anesthesia, surgical techniques, and post-operative care, patients can now undergo complex surgeries with reduced risk and quicker recovery times. This has certainly contributed to more people considering and opting for plastic surgery. Another significant factor is the role of media and the internet in shaping public perception. Social media platforms, in particular, have had a profound impact. People now have access to a wealth of information about different procedures, including before and after photos, patient testimonials, and even live-streamed surgeries. This transparency has demystified the process and made it more accessible to the general public. Additionally, the stigma that once surrounded plastic surgery has diminished over time. It's now more openly discussed and accepted, even celebrated, as a way to enhance one's appearance or restore function after an injury. Lastly, the broadening of the demographic interested in plastic surgery, now including both men and women of various age groups, has also contributed to its growing popularity.
Speaking of demographics, who are the most common clients seeking plastic surgery today? Dr. Mihiraa, are they primarily looking for body modifications, or are there other reasons they come to you?
The demographics of clients seeking plastic surgery have indeed diversified over the years. Traditionally, the majority of clients were women seeking cosmetic procedures, such as breast augmentations or facelifts. While this demographic remains significant, we're now seeing a growing number of men interested in procedures like rhinoplasty, liposuction, and even male breast reduction. Additionally, there has been an increase in younger clients, particularly millennials and Gen Z, who are more open to undergoing aesthetic procedures to align their physical appearance with their self-image. However, it's important to note that not all clients are seeking body modifications purely for cosmetic reasons. A significant portion of my practice involves reconstructive surgeries for patients who have suffered from accidents, burns, or diseases that have altered their physical appearance. These patients seek surgery not just to improve their looks, but to regain normal function and, in many cases, a sense of normalcy in their lives. We also have clients who come in for corrective procedures after previous surgeries that didn't yield the desired results. So, while body modification is a major aspect of plastic surgery, it's by no means the only reason people seek out these procedures.
That's quite insightful, Dr. Mihiraa. With all the advancements you've mentioned, how advanced would you say plastic surgery is now compared to a few decades ago?
Plastic surgery has advanced remarkably over the past few decades, and the progress continues at a rapid pace. One of the most significant advancements has been in the field of minimally invasive surgery. Techniques like endoscopic surgery, where small incisions are made, and the surgery is performed with the aid of a camera, have reduced recovery times, scarring, and overall risks. Another major advancement is the use of regenerative medicine and stem cells in plastic surgery. This has opened up new possibilities in tissue engineering and wound healing, particularly for reconstructive surgeries. Additionally, the integration of technology, such as 3D imaging and printing, has allowed for more precise surgical planning and the customization of implants. These tools enable us to visualize the outcome before the surgery even begins, which is incredibly valuable in both cosmetic and reconstructive procedures. Moreover, non-surgical procedures, such as laser treatments, injectables like Botox and fillers, and skin rejuvenation techniques, have seen significant advancements. These procedures provide patients with options that offer aesthetic improvements without the need for surgery. Overall, plastic surgery today is more advanced and more precise and offers patients a wider range of options than ever before.
Thank you, Dr. Mihiraa, for sharing your expertise with us today. Your insights into the world of plastic surgery are truly enlightening.
It was my pleasure. Thank you for having me.
Now look at Extract 2. Questions 37 to 42. You hear a neurologist, Dr. Mihiraa, talking about the research on brain pacemakers at the Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42.
Good evening, esteemed colleagues. Today, I am honored to present the pioneering research conducted at the Mihiraa Research Institute on the application of brain pacemakers, a breakthrough that could revolutionize the treatment of neurological disorders. The Institute has recently concluded a trial that holds significant promise for the future of neuromodulation therapies. The focus of my presentation will be to dissect the trial's methodology, rationale, outcomes, and implications for patients, while also offering insights into future directions and next steps. The clinical trial conducted at the Mihiraa Research Institute was an advanced exploration into the efficacy of brain pacemakers, also known as deep brain stimulators, in treating a range of neurological disorders. The study was designed as a double-blind, placebo-controlled, multi-center trial, enrolling over 250 participants across 3 different countries. These participants were selected based on stringent criteria, which included patients suffering from Parkinson's disease, essential tremor, and certain types of dystonia, all of which had proven resistant to conventional therapies. The trial spanned over a period of 3 years, with patients being subjected to a rigorous pre- and post-implantation evaluation. Neurological and psychological assessments were conducted periodically to measure the impact of the pacemaker on motor function, cognitive abilities, and overall quality of life. Furthermore, the trial included a unique aspect, analyzing the neuroplasticity induced by the pacemaker. This involved using advanced imaging techniques to observe changes in brain structure and connectivity over time. The rationale behind this trial was multifaceted. Neurological disorders such as Parkinson's disease and essential tremor are debilitating conditions with limited treatment options, particularly for those who do not respond well to medication. Traditional treatment methods, including pharmacotherapy and physical therapy, often fail to address the underlying neural dysfunction. The research team at Mihiraa hypothesized that brain pacemakers could provide a more targeted, adaptable, and sustained therapeutic approach. The decision to pursue this trial was further driven by the need to explore the boundaries of neuroplasticity, the brain's ability to reorganize itself by forming new neural connections. Previous studies suggested that electrical stimulation could enhance neuroplasticity, potentially leading to long-term improvements in motor and cognitive functions. Therefore, the trial was designed not only to test the efficacy of brain pacemakers in symptom management, but also to investigate their role in promoting neural regeneration. The results of the trial were both encouraging and complex. Overall, 68% of the participants exhibited significant improvement in motor function, with some even experiencing near total alleviation of tremors. Cognitive functions, particularly executive functions and working memory, showed marked improvement in approximately 45% of the participants. These findings were consistent across the various conditions studied, though the degree of improvement varied among individuals. Interestingly, the trial also revealed that the effectiveness of the pacemaker was closely linked to the timing and frequency of the electrical stimulation. Patients who received customized stimulation patterns tailored to their neural activity profiles experienced better outcomes compared to those on standard stimulation settings. Additionally, the neuroimaging data provided compelling evidence that brain pacemakers induced significant neuroplastic changes, particularly in regions associated with motor control and cognitive processing. However, the trial also uncovered challenges. A small percentage of participants, around 12%, experienced adverse effects, such as mood disturbances and speech difficulties. These side effects were mostly transient and manageable, but they highlighted the need for further refinement in the technology and its application. The implications of this trial for patients are profound. For individuals who have struggled with debilitating neurological symptoms for years, the prospect of a brain pacemaker offers a new lease on life. The improvement in motor functions can drastically reduce the physical limitations imposed by conditions like Parkinson's disease, allowing patients to regain independence in daily activities. Moreover, the cognitive enhancements observed suggest that these devices could also improve mental agility and overall quality of life. However, the trial's findings also underscore the importance of personalized medicine. The variability in patient responses indicates that a one-size-fits-all approach may not be adequate. The future of brain pacemakers lies in developing algorithms that can adapt the stimulation parameters in real time based on continuous monitoring of brain activity. This could maximize therapeutic benefits while minimizing side effects. Looking forward, the trial opens up numerous avenues for further research and development. One promising direction is the integration of brain pacemakers with advanced neurofeedback systems. By enabling patients to interact with their own brain activity through a user-friendly interface, it may be possible to fine-tune stimulation settings for optimal outcomes. Another area of interest is the potential use of brain pacemakers in treating neuropsychiatric disorders such as depression and obsessive-compulsive disorder, where traditional treatments have been less effective. The trial also highlights the need for more extensive longitudinal studies. Understanding the long-term effects of brain pacemakers, particularly their impact on neuroplasticity, will be crucial in refining the technology and expanding its applications. Collaboration between neurologists, engineers, and data scientists will be essential to overcome the challenges and harness the full potential of this innovative treatment. As we move forward, the next logical step is to initiate a larger, more diverse trial to validate the findings from the study and explore the broader applicability of brain pacemakers. This could involve expanding the patient pool to include individuals with other neurological and neuropsychiatric conditions. Additionally, the development of next-generation brain pacemakers with improved precision, reduced size, and enhanced battery life is imperative. Furthermore, regulatory approval and ethical considerations must be addressed, particularly concerning the long-term implantation of these devices in the human brain. The establishment of standardized guidelines for patient selection, device implantation, and postoperative care will be critical in ensuring the safe and effective use of brain pacemakers in clinical practice. In conclusion, the research at the Mihiraa Research Institute represents a significant milestone in the field of neuromodulation. While the trial has demonstrated the potential of brain pacemakers to improve the lives of those with severe neurological disorders, it has also raised important questions and challenges that must be addressed. With continued research and collaboration, we can look forward to a future where brain pacemakers become a standard tool in the fight against neurological diseases.
That is the end of your OET listening test. Now check the answers.